everyone. Welcome to today's Lunch and Learn. So great to have you here. I am going to give everybody just a minute or two to log on so that you can get settled in for the hour. We're going to make it as quick and painless as possible. So just get ready. If you want to take a minute to familiarize yourself with the widgets on the screen, you should be able to move around the slides and the presenters so that you can see us or not, depending on your preference. And and we'll talk a little bit about the poll questions that you can answer during the presentation. And in just a minute, we'll jump right in because we have a full schedule. Okay, so just to be respectful of your time, let's get started. Welcome, like I said, to HRAs from Confusion to Control, How to Harness HRA Flexibility to Serve Your Clients Better, brought to you by Clarity Benefit Solutions. My name is Becky Crutchfield. I am the Director of Partner Growth and Business Development at Clarity Benefits, and I am here with my colleague, Eddie Larned.
Thanks, Becky. Good afternoon and good morning, everyone. My name is Eddie Larned, Vice President of Sales with Clarity Benefit Solutions. I will be helping Becky with today's continuing education course, handling some of the questions, providing some commentary. So thank you all for joining us. We really look forward to chatting about HRAs with you over the next hour.
Okay, so here's a look at what we're going to cover. First of all, an overview of HRAs and what this employee benefit is all about. We're going to take a look at how HRAs are being used today. Then we'll examine the case for offering HRAs from various stakeholders' points of view. Then we're going to outline two basic types of HRAs. We'll drill down into the most prevalent plan design options that are customizable to clients' needs. We'll discuss how HRAs work with other employee benefits like HSAs and FSAs. We'll give some thoughts on what brokers and employers should look for in an HRA partner. And finally, time permitting, we'll answer a few questions. But first, some housekeeping rules. So just to give you guys an idea of how it's all going to go down here, we are going to go through this presentation. There will be a few poll questions. And when you get the poll questions, just be aware that there's going to be a place on the actual presentation where you can answer the poll. And when we get there, we'll explain it a little bit further. But you want to answer as many questions as you can because this platform does track just to make sure that we can provide the CE credit for you, which we will take care of. All of those will come after the webinar is complete. We will send you confirmation of your webinar, of your CE credit. Also, don't worry, nobody can hear you. We've got everybody muted. And let's see, I think that, and make sure you stay on the full amount of time because it also does record the amount of time that you're here. So we need you to stay on as long as you can. So with all of that, here we go. Ready, Eddie?
Ready.
All right, so we're going to start with an overview of this important employee benefit, HRA, Health Reimbursement Arrangements. So what is an HRA? Well, according to the U.S. government, health reimbursement arrangements are employer-funded group plans or arrangements or employee benefits from which employees are reimbursed tax-free for qualified medical expenses up to a fixed dollar amount per year. Let's break that down a little. HRAs are 100% employer funded. Employees may not contribute to them. Allowance amounts and rollover rules are set by the employer. The IRS eligible expenses covered are set by the employer. Employees do not have to pay taxes on the amounts they receive from their HRAs. All employees cannot take their HRA to a new job, of course. So how did HRAs come to be? Let's take a quick glance at the history of this important benefit. Okay, hold on, because this is the part that's a little bit tedious, but we're going to get you through it, okay? In 1974, Congress passed the Employee Retirement Income Security Act, or ERISA. One of the after effects of this landmark legislation was the official creation of Health Reimbursement Arrangements, or HRAs. Part of ERISA's intent was to make sure that employers' arrangements for health benefits were provided fairly to all employees. The creation of HRAs spurred many employers to move to lower cost, higher deductible health insurance plans. Now, with HRAs, they could provide tax-free reimbursement to employees to help meet the higher employee deductibles that high deductible health plans brought along with lower employer premiums. This arrangement came to be known as an integrated HRA because it is integrated with a group health insurance plan, and it's usually a high deductible health plan. This is the HRA that you may already be familiar with it, as it really remains the most prevalent type of HRA offered today. Many companies set up their HRAs to cover the cost of deductibles for the high deductible health plan that it integrates with. But as healthcare costs continue to rise for both employers and employees, small businesses in particular were finding it hard to afford any form of group coverage, including high deductible health plans. In 2002, the IRS issued a notice that allowed employers to offer HRAs that did not have to be integrated into a group health plan. The standalone HRA was born. An HRA could now be the only health benefit offered by an employer. So many employers chose to use this type of HRA just to cover some or all of the cost of the employee's individually purchased health insurance premiums. Then in 2010 came the Affordable Care Act, which shook up the entire healthcare industry. Certain ACA provisions had unintended consequences that greatly impacted HRAs. Employers were unclear on the rules for reimbursing employees for medical expenses with or without an underlying group plan, and the growth of HRAs stalled. One ACA interpretation was that any company that reimbursed for health insurance, including for individual plans, as many small businesses did with standalone HRAs, was technically a group plan. And group plans had to provide preventative care at no cost or be penalized, which standalone HRAs from small businesses were not able to do. So in 2013, the IRS ruled that HRAs needed to comply with ACA rules and be integrated with an underlying ACA compliant health plan. Now, this essentially ended for the time being the standalone HRA. The rule creates with ACA's impact now, small businesses that couldn't afford group insurance didn't have many options to help employees pay for health care. So in 2016, the 21st Century Cures Act sought to redress the state of affairs, creating the Qualified Small Employer HRA, colloquially referred to as the QSEHRA. This gave small employers a means of providing employees help with individual insurance premiums and other out-of-pocket medical expenses without violating the ACA. Now, we're going to look into it in more detail later, but essentially the QSEHRA became a new iteration of the standalone HRA, allowing employers with 50 employees or fewer to offer a healthcare reimbursement benefit that didn't require to take on the expenses of a group coverage. So in 2017, in an executive order, the Trump administration directed the Secretaries of Labor, Treasury, and Health and Human Services to propose regulations that would increase the usabilities of HRAs to expand employers' ability to offer HRAs to their employees and to allow HRAs to be used in conjunction with non-group coverage. And the result was a rule issued by the IRS, the Employee Benefits Security Administration, and the Health and Human Services Department in June 2019. The rule creates two new HRAs available from January 2020, the Individual Care HRA and the Accepted Benefits HRA. We're going to go into these in greater detail in a moment, but in a nutshell, the ICHRA became another option for a standalone HRA, going beyond the QSEHRA, allowing employers to reimburse premiums and certain expenses employees paid under individually purchased health insurance. Employers don't need to tie it up to a group health plan, and unlike the QSEHRA, it's not limited to employers with 50 or fewer employees. With the EBHRA, EBHRA, employers who offer group insurance can provide reimbursement for certain accepted benefits, even to employees who decline their group coverage. Again, we're going to go into the details in just a moment. So we're going to take a pause and let Eddie run us through a poll question here.
Yeah, we'll give Becky a break here and go through our first poll question, which is actually a series of 3 different questions. Again, as a reminder, please answer these right here on the slide when I change slides in just a moment, as opposed to entering it in the chat. That way we can track all of the results and talk about some of the trends that we're seeing. So you can answer these questions as true, false, or maybe. And the first question is, employees can contribute to their HRAs. True, false, or maybe. So we'll give everyone 10 seconds, 15 seconds to go ahead and answer that to the best of your ability, and then we'll move right along, look at the results, and then check out the next question. Looks like some of these answers are coming in, so we will go ahead. Again, the first question, employees can contribute to their HRA, and the answer there is false. So at least my screen is showing that almost 80% of you got that one right. Remember, HRAs are only employer funded. FSA, HSA, those can be both employer or employee funded, but an HRA is solely funded by the employer. Next question, HRA reimbursements are tax-free for employees. True, false, or maybe? Looks like a couple of these answers have come in. Just refresh this. And looks like we're at 50-50. The answer is true. HRA reimbursements are tax-free for employees. And our third question, HRA reimbursements are use it or lose it for employees. Give everyone a few more seconds to answer this last question, and we'll check out the results, and I'll turn it back to Becky here.
Eddie, I realized that I forgot to mention to everybody, if you're having any kind of a technical issue, or if you have questions, actually, if you have questions for Eddie or me, you can put that in the chat. We have a whole team of people that are working behind the scenes to make sure that you get the most out of this session. So be sure and send us any questions that you have, or ask us any technical questions. Sorry if you've had any trouble getting on. Just let us know in the chat if that's the case.
Thanks, Becky. Looks like almost everyone has responded to this question. HRA reimbursements are use it or lose it for employees. We have a couple of different answers here. Almost 70% of you said true. The answer is actually maybe. Employers can choose to allow unused HRA funds to roll over from one plan year to the next if they want. As Becky mentioned, they're not necessarily portable, meaning you wouldn't be able to bring it to a new job. You can continue your HRA as part of COBRA, which we're going to talk about later. But as far as employees who are staying employed and staying eligible for this benefit, it's up to the employer. Some employers do allow their HRAs to roll over year after year if you have unused funds. That is definitely uncommon, but it is technically something that can be done. And we'll talk about some of those strategies later on in the presentation.
Thanks, Eddie. Okay, so what really makes HRAs different from other employee benefits is the extent of employer control over the healthcare costs that HRAs deliver, along with the great flexibility in designing HRA plans. With HRAs, employers define the amount of funds provided, what's covered, whether employees share costs, and when the HRA is activated. We'll look at this in more detail when we talk about plan designs a little bit later. But Eddie, I'm hoping you can elaborate a little bit on this.
Yeah, Becky, I mean, this flexibility, this level of customization and employer control is really what makes HRAs such an attractive and flexible vehicle or benefit. You know, when it comes to an HSA, the employer has zero control. Those rules are all governed by the IRS, and it is what it is. It covers what it covers. It has maximums. It has tax rules. FSA, I mean, you have a little bit of flexibility. You can determine your own maximum under the IRS limit. You can choose grace period versus the limited rollover. But with HRA, there's a ton of customization. You could fund $50 for each employee. You could fund $10,000 for each employee. You can make the funds available just for dental expenses, or you can make the funds available for all IRS 213D. So that's the nice thing, is that it's not as cookie cutter. It's not a one size fits all. It really varies and can be a tool that can be used differently for every organization, every type of employer, depending on what their benefits goals are and what their financial goals are. So that's where you can really rely on, your insurance broker. Of course, you all on the call, that's where you come in. Also, your HRA partners can serve as consultants and help advise your clients, what fits your benefits goals, what fits your financial goals. So that's one of the best parts of the HRA, and we're going to elaborate on that a little bit later.
Thanks, Eddie. So how do HRAs work in practice? As we'll see, there are different types of HRAs with different rules, but mostly the work boils down to these 4 steps. First, the employer makes available the predetermined monthly allowance that employees may receive. Generally, it's put into an account for each employee and managed by the benefits administration partner. Second, the employee has a qualified expense, for example, a copay or prescription drugs. Now, since HRAs are reimbursement arrangements, employees typically must pay for the services first themselves, unless, of course, their HRA plan design allows for a debit card to access their funds. Benefit administrators might typically offer multiple ways for employees to purchase qualified healthcare services, including via debit cards or an online portal. Now, third, the employee submits proof of purchase. Benefits administrators offer various ways to accomplish this as well, including the ability to submit receipts via mobile apps. And finally, the employee is reimbursed by the employer unless they have already swiped their debit card to pay for the expense. Again, a variety of ways may be set up to accomplish this, including automatically via insurance carrier data, if it's an HRA that's tied to a group insurance carrier, of course. So before we look at the prevalence of HRAs in the market today, Eddie, will you do another poll question for us?
Absolutely. So this one's always interesting, and I'll explain why in just a moment. But this question is, what percentage of your current clients would you estimate currently offer HRA options? You can answer this as 0 to 25%, 26 to 50%, 51 to 75%, and D, 76 to 100%. The reason I think this is always an interesting question, and it would be cool if eventually, we can have a map of the country and see how these results vary from state to state and region to region. But what I've noticed, at least with our sales team, is that in some parts of the country, like the Northeast, HRAs are extremely popular. I would say, in the Northeast, a lot of times you're looking at B, C, and D for the percentage of, clients that are that offer HRAs. But in other parts of the country that we do a lot of work, like the Southeast, for example, Florida comes to mind, they're much more uncommon. And there's a lot of HSA action there. There's a lot of FSAs being offered, but HRAs just never really made a huge impact in that market. So I just bring that up because it's always interesting as we talk to brokers from all over the United States to ask this question and get an understanding of how often they're actually dealing with HRAs or how much their clients are actually asking about them. So it looks like almost everyone has gone ahead and responded here. Thank you so much for your participation. And as we kind of predicted, it's 0 to 25% is the result that about 70% of you said. So that's overwhelmingly the majority here, followed by that 26 to 50% bracket, with about a quarter of you responding. And then we have a handful in those other two quadrants there. So thanks again for your participation.
Now let's look at some recent statistics about how HRAs are being utilized today. HRAs are really, as Eddie was saying, not yet as prevalent in the market as are other tax advantage benefits like flexible spending accounts and health savings accounts, especially in certain geographic areas. But according to SHRM, about 16% of employers are currently offering HRA options. Compare that to 63% that are offering FSAs and 57% offering HSAs. However, it is important to realize that HRAs are a rapidly expanding market. In 2010, there were about 10 million HRAs, and in 2022, that's grown to 16 million HRAs, which is a 60% increase. And the more recent options of standalone HRAs like ICHRAs and QSEHRAs are growing even faster. Since 2020, ICHRAs have grown by nearly 350% and QSEHRAs by 70%. That's according to the HRA Council. So they're not as popular as HSAs and FSAs, but where do employees contribute their money? They're not as popular as HSAs and FSAs. Mainly probably because employees contribute their own money to those accounts. But what is the case for HRAs, which are essentially funded by employers? First, let's look at why HRAs might appeal to employers. Well, HRAs provide maximum cost control for employers because they're a defined contribution program. Integrated HRAs allow employers to lower their health insurance premiums by virtue of switching to a high deductible plan from a higher cost plan. HRAs can complement high deductible health plans when employers devote part of the premium savings to help employees offset the higher deductibles. As noted, there's a great deal of flexibility in plan design with options for what's covered, what amount is provided, when reimbursements kick in, etc. And employer contributions are 100% tax deductible and not subject to federal, state, or Social Security taxes. So why are HRAs attractive to employees? Well, employees like HRAs because essentially they're extra money provided to them to pay for healthcare. And it's money that they don't have to pay taxes on. So employer HRA contributions are typically excluded from an employee's gross income. And they don't have to increase, they don't increase an employee's tax obligation. Typically, HRAs help employees mitigate the cost of health insurance, whether it's helping them cover the high deductibles through an employer's group plan with an integrated HRA or paying the premiums through their individual plan with a standalone HRA. And we're going to go into more detail on this later. And HRAs can usually be used to pay for care for an employee's dependents as well as for themselves. Also, if the employer chooses, the HRA funds can roll over from year to year, just like we were saying in the poll. So what do HRAs have to offer brokers? Well, as we noted, they are becoming more and more popular with employers looking to control healthcare costs. So brokers will probably need to have them in their portfolio as competitors, their competitors most likely will. Now, HRAs also offer the opportunity to pitch new products, namely ICHRAs and EBHRAs, to potential new clients. But before we drill down to the details of different types of HRAs, let's take another poll.
All right, so this next question is, what aspect of HRAs will be most appealing to your clients? You can answer this as A, the ability to control costs, B, the ability to offer a useful benefit to employees, or C, the ability to customize the HRA to a certain business's preferences. So we'll give everyone a few seconds to go ahead and respond to this here within the slide, and then we'll go ahead and check out the results. All right, looks like quite a few of these answers are already coming in. So it's the ability to control costs. And I think that was the same trend that we noticed on our first continuing education course on this topic. So that is a great response, ability to control costs. We'll dive into that a little bit more and some other strategies in a couple of minutes.
And despite the complexity of HRA acronyms and different plan types, which we'll dive into soon, it is important to remember that the crux of things, there are just two basic types of HRAs, integrated HRAs and standalone HRAs. First, let's look at the integrated HRA. This is the most prevalent HRA in the market, and for brokers, it will be the most lucrative HRA because what an integrated HRA is integrated with, of course, is a group health plan, which obviously leads to commissions for brokers. And as we suggested, when we looked at the history of HRAs, the integrated HRA typically goes hand in hand with the employer switching to a high deductible health plan from a traditional group plan. And with that switch, the employer's premium typically goes way down, but the employee's deductible typically goes way up. So to soften that blow, employers can take some of the money that they're saving on premiums and devote it to giving employees the benefit of an HRA. Often the amount devoted to HRAs will cover all or a significant percentage of a higher deductible. And we're going to go deeper into the other plan design options for integrated HRAs later. But now let's look at the other main type of HRAs, the standalone HRA. Some employers, particularly small employers, still can afford to offer group plans, and even if it is a high deductible health plan, but they do want to offer some sort of medical expense benefit. So if you'll recall the history section again, the government made QSEHRA as an option for businesses with fewer than 50 people. And then under the Trump administration, 2 new standalone HRAs, the ICHRA and EBHRA, were introduced in 2020. Now, the EBHRA is something of a special case as group coverage is involved, but we're going to get into that in just a minute. Let's take a look first at the qualified small employer HRAs, or QSEHRAs. This type of HRA is only for small businesses with 50 or fewer employees. To offer a QSEHRA, the small business must not offer group health insurance to its employees. Thus, employees are responsible for getting themselves covered by an ACA-compliant health plan, possibly on the individual market or through their spouse's employer's group coverage plan. Unlike integrated HRAs, there's a government set annual limit on reimbursements an employer can pay. For 2023, that limit just happens to be $5,850 for individuals and $11,800 for families. Then as of 2020, a new type of standalone HRA was introduced, the Individual Coverage HRA, or ICHRA. Unlike the QSEHRA, which is only available to small businesses, any size business can offer the new ICHRA. There are no government set minimum contribution requirements and no maximums for allowances. One thing that really distinguishes the ICHRA is the employer can offer a group health plan to some classes of employees and an ICHRA to others. This slide shows some of the ways that employees can be classed, such as full-time or part-time. So, for example, an employer can offer full-time employees a group medical plan and part-time employees an ICHRA. However, employers may not offer employees in the same class a choice between group health insurance and the ICHRA. And an ICHRA must be offered on the same terms to all employees within a class, with some exceptions, which Eddie will discuss. So there is a great deal of flexibility with the ICHRAs. Eddie, let's talk about that now. Can you elaborate on some of these exceptions within a class?
Yeah, so some of the exceptions, for example, are kind of the same reason you could fund different amounts for a standard integrated HRA, meaning it's what participation level someone's enrolled in. Basically, you could give a single participant, say, $250 a month. You could give employee plus spouse $500 a month, employee plus children $750, and employee plus family $1,000, for example. Of course, that's advantageous and a nice thing to do for your employees because the more larger family size you have on a plan, the premiums are going to be higher. In addition to that, you can also fund higher amounts in the ICHRA for older employees than younger employees. Again, premiums on the individual marketplace for a 60-year-old are going to be higher than that of a 25-year-old. And then finally, you can also differ the funding amounts based on geographic region. So the premiums in California might be higher than the premiums in Oklahoma. So if you wanted to fund a higher amount for employees in one state than another, you're certainly welcome to do that. So there are a lot of different ways you can utilize these different classes to create the right benefit offering for your employee population. Like Becky said, the important thing is you can't give the employees the option of having the ICHRA and a group plan and they choose which one they want. You as the employer would have to make that decision for them. So like Becky mentioned, you could say all salaried employees get a group plan, all hourly employees get ICHRA reimbursements. They go off and purchase their own individual plans. Same thing again with full-time or part-time. You have seasonal, you could differ it with collective bargaining agreement. So far more flexibility here than a QSEHRA. The one advantage that the QSEHRA really has over the ICHRA is that someone could be enrolled in a spouse's group plan with the QSEHRA and also receive that reimbursement. Whereas with the ICHRA, you do really have to be enrolled in an individual marketplace plan.
So many different pieces. So in 2020, a second new type of HRA was introduced, the Accepted Benefit HRA. It's not growing as quickly as the ICHRA, but you should still be aware of it. We're classifying it with standalone HRAs, but as you'll see, there's a wrinkle here. Basically, EBHRAs allow employers of all sizes to reimburse employees tax-free for certain medical expenses that are not covered or accepted by their insurance plan. Such expenses include copays, deductibles, vision and dental insurance, COBRA premiums, short-term limited duration insurance, long-term care, nursing home care, and home health care. Now, here's where that wrinkle is. Let's see. The EBHRAs must be offered in conjunction with a traditional group plan. So it's tricky there. Why are we including it, though, in a standalone plans? Well, because uniquely for this type of HRA, participants do not have to be enrolled in the group plan to use it. They just have to be offered it. So the EBHRA may or may not be integrated with a group plan, and that makes it really hard to classify. EBHRAs cannot be used for an individual or group plan premiums. And it's 2023, the maximum annual contribution can exceed $1,950. And it's understandable why brokers are not that enthused about standalone HRAs as they are for integrated HRAs, obviously, because standalone HRAs are not tied to group health plans, which means they're also not tied to commissions group health plans pay an employer's broker record. That being said, ICRAs and QSEHRAs are really gaining in popularity. And if you're competing for smaller employers who feel they just can't offer a group health plan option because of the cost, you need to be aware of these options because your competitors will be. Eddie, any comments on this one?
Yeah, I definitely agree with your point in that, our broker and consultant partners definitely don't lead with this benefit, nor would I in that situation. However, it is a nice extra product to have in your overall toolkit. I think it can be advantageous to provide a kind of creative, out-of-the-box solution for maybe a smaller organization, maybe a startup that they have 2-3 employees. It just doesn't make sense for them to have a group plan, but allows you as a broker or consultant to get in there really early, build that relationship, provide maybe a creative solution that no one else has talked to the group about. And we all know how some of those small groups, those startups can really grow very fast over time. And maybe, you've got yourself in there at an early stage and 5 years later, they have 70 employees. So it can be advantageous in some scenarios. We've also seen certain groups that have 400 and 500 and 600 employees that are maybe in an industry like a staffing agency where they have a tremendous amount of turnover, where an ICHRA is more advantageous than, say, a group plan, or at least for a portion of their population. And of course, brokers, I think, can always add commission into these types of administrative fees. I think that's absolutely justified because you are, providing a service, you are serving as a consultant and doing a lot of work for these plans. So I do think there is some money to be made in it, certainly not as much as a group plan, but nice to have the option in your toolkit.
Okay, now let's get back to the more common integrated HRAs. One of their key features, as we've noted, is how much flexibility and control they can offer employers in their design. This is an area where informed advisors can help them create a plan tailored to their unique needs and preferences. HRA plans can be customized in ways including the amount employees are reimbursed, what eligible expenses are reimbursed, whether or not employees share some of the costs, and at what point HRA reimbursements kick in. Eddie, we call you Mr. HRA at the office, so I know that plan design is sort of your thing. You have any comments on these aspects?
Yeah, I mean, like we talked about earlier, there's a ton of customization with HRAs. Anytime there's a gap in the overall benefits package, an HRA could be considered. A lot of times it is the right solution. We'll give some more specific examples later, but for example, it doesn't have to be integrated with a high deductible health plan. You could be on a traditional plan and your copays went up a little bit and you want to cover that gap, or your deductible increased by $1,000 and you want to keep the deductible at the exact same threshold it was earlier. You could utilize it for that type of thing. We've set up HRAs just to cover specific items like mental health visits not covered by an insurance carrier. You can have employees have some skin in the game, have some cost sharing. The amount reimbursed again can vary, and also when those funds are available. So usually with HRAs, the funds are available at the start of the year. Say you get $1,200 right on day one of that plan year to use over the course of the year. But if you wanted to, you could fund it monthly at $100 a month, or you could fund it quarterly or semi-annually. So all of these different aspects allow the employer to customize the plan, keep their utilization in control, and make sure that it hits their financial goals, but also fills that benefits need.
And before we delve further into plan design, Eddie, will you take another poll question for us?
Absolutely. Next poll question. Which way of customizing an HRA plan do you anticipate that your clients will be most interested in? You can answer this as A, limiting what eligible expenses are covered. B, the employee/HRA cost share responsibility, giving the employee some skin in the game. C, offering reimbursement for all eligible expenses immediately. And D, increasing utilization with tools such as debit cards. So everyone can go ahead and answer this question. We will check out some of the results and then just take a deeper dive on some of these aspects. Okay, looks like we are already at about 50% of our responses in. So let's go ahead and check out the results. And at 42%, we have the employee/HRA cost share responsibility. I tend to agree with that, because again, if you want the absolute richest benefit package possible, because you want to attract and retain the best employees, and your budget is flexible and spending is not really a concern, you could fund 100% of a maximum out of pocket if you wanted to. However, if that's not the case and you are held to a more strict budget and you can only fund, say, 25% per claim or $20 per prescription swipe or anything like that, you're certainly welcome to do that.
I really think employees kind of expect to have a little bit of skin in the game, What expenses can an HRA cover? There are nearly 300 listed in IRS Publication 502, which defines medical and dental expenses eligible for HRA reimbursement. This list includes deductibles, coinsurance, physical therapy, prescription medications, over-the-counter medications, and insulin. When designing their company's HRAs, employers have the ability to set which of these eligible expenses their company will reimburse. Total control.
And that's the thing. Think of the list of eligible expenses for FSA and HSA. It's that same list, that 213D under IRS Publication 502. That's as broad as you can make it. But again, you can make it as narrow and as specific as you want as well. So it's a whole spectrum that the employer has control over.
So how are employers determining which expenses their HRA will cover? A common design is an HRA that reimburses all uninsured medical expenses. In other words, employees can use them for any of the IRS Publication 502 eligible expenses that he was talking about that don't get paid for by their group insurance and that they need to pay for out of pocket. Another option is an HRA designed to pay only expenses directly related to the group medical plan coverage. For example, deductibles, coinsurance, copays. Or there's a limited purpose HRA, which is designed to reimburse employees only for out-of-pocket dental and vision expenses. Additionally, there is what is termed a select services HRA. These are used when employers wish to provide expanded coverage for a list of select services that are not covered by a health plan, possibly due to environmental, social, or regulatory factors. For example, a select services HRA might be designed to cover fertility benefits or birth control services. So these are all options for designing an HRA plan based on what expenses are reimbursed. Eddie, do you have any other examples?
Yeah, I think that fertility benefits one is a really good example. We were actually working with a broker who was trying to pull an employer out of a PEO, take on the BOR there, and based on the group's size, they couldn't get the carrier to cover any fertility benefits, IVF, egg freezing, things like that. So they were basically able to utilize an HRA to fill that gap, and the broker is able to win the business. So there are a lot of different ways you can leverage this. Another example I gave earlier, we were working with another broker who was working with his client, and they had a collective bargaining agreement. And as part of the collective bargaining agreement with the union, they promised unlimited mental health visits, but the carrier had a cap on it. I forget if it was in network or out of network, but basically we were able to craft the HRA plan design to only cover mental health visits that were not covered by the insurance carrier. So I think traditionally we have this mindset of, oh, an HRA is only integrated with a high deductible health plan. That's just not the case anymore. It can be really integrated, as Becky's mentioned a couple times, with any group sponsored medical plan, and it can be used in a lot of different capacities.
Well, talk about an attractive, benefit for an employee coming over to your company, plus increased participation. I mean, that's a huge one for us, right? For brokers and for us. So HRA plan design, based on another way that some employers may want to design a plan is based on employees sharing some of the costs. Now, this motivates employers to make more informed consumer choices about their healthcare expenses, since they have some skin in the game. How are employers implementing this? With HRA deductible design, employees are required to pay out of pocket a certain amount or a deductible before the benefit kicks in. With the HRA coinsurance design, the employer reimburses a portion of all eligible medical expenses. For example, the employer might pay 80% of the cost of prescription medications, while the employee pays 20%. Now, another approach is the HRA split copay design. So let's say an employer has switched to a less rich traditional group plan, and the copays for office visits are going to increase for employees. To mitigate the impact of this, an employer could design a plan that reimburses employees for part of the higher copay, say $20. So it's effectively becomes closer or the same as what employees are accustomed to paying. And let's take a closer look at how split copay design might work. Now, this chart shows various services, the total copay cost for each, and how the HRA and the employee might split the cost. Eddie, would you walk us through this creative plan design?
Yeah, this fits into that example you just gave, Becky. So this is definitely more of a more complex HRA plan design, but I think everyone might appreciate the concept. It's just what Becky was just saying about, you're on a traditional plan. Let's say the copays were 30 and 50. You move to another plan, or it's less rich plan. It's still not high deductible health plan, and all of a sudden your copays have gone up by $20 each. If you want to keep the employee whole, you could use the HRA and use a debit card and program the debit card to only swipe $20 for each office visit. That way the employee is kept whole. And the really cool part is if you also layer that with an FSA, one card swipe, and the card can pull $20 out of the HRA and the remaining 30 for primary or 50 for specialist in this example out of the employee's FSA with one card swipe. Same concept here with the emergency room. The emergency room copay was $250. Let's say it went up to $500. Let's use the HRA to cover that increase. Same concept with the deductible. When you are leveraging this type of plan design, you probably don't want that deductible reimbursement on the debit card. That's usually not that big of a deal, since a deductible on a traditional plan like this probably only has inpatient, outpatient, and other major medical procedures applying towards it. So your average employee is going to submit 0, 1, 2 claims a year. So not that big of a deal. And then when it comes to prescription drugs, you can either do that flat dollar amount, like 10% per prescription, $10 per prescription, for example, or you could do any percent split. And that can be done on the debit card as well. So again, whether it's a high deductible health plan or a traditional plan where you're just seeing higher copays, you can program the card to pay, 75% per prescription. And the employee would be on the hook for the remaining 25%, which they would either pay out of pocket or, it would automatically be pulled out of their FSA when the card is swiped. So debit card technology has come a long way. They are smart cards. They're not brilliant cards. They have some limitations. Well, that's where you can really rely on your HRA partners. And seeing this chart, again, really creative, gives you some good ideas, but it's also very important to remember that simple is best. And this might not be the best solution or plan design for every single group, because it does require some education to employees. And we want to keep this simple so the employee understands how much to swipe and when. But again, that's where the parameters that you can build around the debit card can also help maintain a very easy and positive user experience.
The last plan to sign approach that we'll look at centers around when the HRA is activated. The most straightforward approach is the employer pay first. So in this approach, HRA reimbursement funds are available immediately and employees can access them until they run out. Then you can have an employee pay first model, which is essentially the same as an HRA deductible approach that we talked about earlier in that cost sharing model. The employee pays a specified amount before the HRA kicks in. Now, another variation, of course, is the donut hole model. Eddie, explain the whole donut hole model.
Yeah, so the donut hole model is another creative solution. This typically fits in with a high deductible health plan, but it doesn't have to. You could also utilize this for a deductible for a traditional plan, but it's basically just stacking multiple layers of HRA funding. So it's the third illustration down here on the left on your screen here. And as you can see, the HRA funds the first $2,000. Once those funds are depleted, the employee's on the hook for the next $2,000. And then the HRA kicks back in for the final $1,000. This is also a nice way to control utilization, because if you have a population of 100 employees, on average, maybe only 5 or 10 people are going to tap into that last bucket here in the deductible. Sure, a lot of folks might access that front $2,000, but once that donut hole comes into play, not everyone's going to get through that. So again, kind of what Becky said earlier, all of these different concepts here encourage consumerism, have employees maybe thinking, oh, maybe I should ask if there's a generic equivalent because I have some skin in the game and I don't want to tap into my responsibility if I don't have to. Or maybe they're shopping around for something predictable, or a type of claim that isn't urgent, like an MRI or something, allows them to find a provider that has a better price or better negotiated rate on that. So again, back to keeping it simple is definitely best. You wouldn't want to make multiple donut holes. I've seen that before. You want to keep it simple, but this can be definitely a couple of effective strategies.
Thanks, Eddie. So there are a number of ways, obviously, to design an HRA plan to address just how the employer wants an HRA to be used by their employees. But now we're going to move on to my favorite part, which is how HRAs interact with other popular employee benefits, namely HSAs, FSAs, and COBRA. And I'm going to see if, Eddie, you can just take these next few slides. We're getting close to the end, so if you guys can just hang on, this is a really important piece.
Absolutely, Becky. So let's start with HRAs and HSAs. Very common misconception that you can't have both. In some scenarios, you can't have both, but if you do structure your HRA properly, you can take advantage of both of these benefits, and it becomes a very attractive overall offering to an employee. So what we call this is HRA HSA stacking. I don't think that's an official term, but it makes sense when you think about the concept. But basically, the IRS says that you cannot have other funding, meaning an HRA funding, if you're going to contribute to an HSA until the HSA minimum deductible has been satisfied. What that means is that the HSA minimum deductible, which for next year is $1,600 for an individual and $3,200 for a family, that must be paid or satisfied by the participant before an HRA can kick in. So you can't have an HRA upfront paying first dollar coverage like we saw on one of the prior slides. Instead, the HRA can kick in after that first $1,600 has been satisfied or after that first $3,200 has been satisfied. So that responsibility can be paid out of pocket by the employee or out of their HSA. But what this does is this can really reduce the overall exposure of a deductible while still maintaining HSA eligibility. So everyone knows HSAs are a terrific tax savings vehicle, triple tax advantage, long-term investment vehicle. But sometimes if you have a $5,000 deductible and your HSA maximum contribution is well under that, it doesn't always make sense if you're not a really healthy person to enroll in that. So if the employer wants to kind of subsidize and cover a portion of the back end of the deductible, you can really bring down that overall deductible exposure and still let people contribute to the HSA, take advantage of some of those tax savings, and have this terrific long-term investment vehicle accessible to them. HRAs and FSAs, yes, these two layer together very well. The FSA can pay for any IRS 213D eligible expenses that are not already reimbursable under the HRA. And if the same expense is eligible to be reimbursed through both plans, the cost will be reimbursed by the plan that the employer has set up to pay first, which is usually the HRA. Again, not always, but can vary depending on plan design. But it is important you cannot double dip. So you can't have one claim and submit that towards both your HRA and your FSA. But usually the way this is managed is that, let's say the HRA is paying first dollar and it's just for medical expenses, medical deductible expenses. A debit card would be programmed so that the HRA pays first for anything that's coded as medical. And then if you swipe for something non-medical, like a dental or a vision or an over-the-counter expense, the card is smart enough that it will bypass the HRA and automatically pull funds from the FSA. So this can definitely be advantageous, especially if you have, let's say, a deductible of $5,000 and you're funding the first $2,500 of it. For those employees who know that they are heavy utilizers and they're going to meet that deductible, this allows them to also cover that last $2,500 on a pre-tax basis through a flexible spending account. So a lot of different ways to manage this, but just provides extra financial and tax savings for the employee. Obviously, just requires a little bit of education, but the way you can program a debit card, it can really take all of the thinking out of it for the employee. And then we have HRA with COBRA. So yes, HRA is a COBRA eligible benefit. You must offer the HRA as continuation as part of COBRA. However, the employee must pay an additional COBRA premium in order to access those HRA funds. So how is that premium determined? So you'll see on this slide that there are really two different models for HRAs and how you determine the utilization. So you have the first year when no prior utilization data exists, and then you have subsequent years where you can adjust this calculation based on your employee population's utilization of the HRA from a prior year. So on the left, we have an example of what sort of monthly premiums would be required for $1,000 worth of HRA funding. In year one, you're imposing the 75% utilization model. You could also get an actuary to provide an estimate for a different number, but it's really widely accepted to just use 75%. And then that premium would come out to, again, in this illustration, $63.75 per month. That is how much an employee would have to pay in addition to their medical premium to have access to that HRA funding. So really only someone who knows for certain that they're going to spend that money, that HRA money, is going to continue the HRA on COBRA. Most folks go ahead and waive it. And years 2 and onwards, instead of using the 75% model, you would just use whatever your utilization was for the group in the prior year. And I also want to point out that it's 750 times 1.02, and that's that extra 2%, which an employer can charge for the COBRA administration cost. One other aspect to this is you do have the option, or an employer has the option, of allowing the HRA and the medical plan to be bundled, meaning on COBRA, you take both or you take neither. There's no other option. Or more commonly, it's kind of like a buy-up concept. You can take just the underlying group medical plan and then buy up to also take the HRA. So you could take one or both. I kind of like that model a little bit more because you really don't want people taking the HRA money because those are people who are probably going to spend it and, again, just drive up your utilization. So, again, has to be offered, but you do, an employer does get to charge a little bit back. So that they're not totally out of pocket out of all that funding.
Thanks, Eddie. That's a whole lot of information for us to really look at, a lot of options and a lot of things that they need to be familiar with. So we've established that HRAs are somewhat complicated. So employers have to work with a good benefits administration partner. That's really where they're going to get their advice on how to make this all work together. The administration partners can help cut through the complexity and come up with a plan that really gives them more control over their healthcare expenses. So what should they look for in an HRA partner? Well, expertise in HRAs, including in the area of compliance, and they should have the ability to help them calculate how much money can be saved in healthcare costs by leveraging different HRA plan designs. Partners who offer a range of HRA products and have the ability to customize them with creative plan designs are extremely valuable as our partners who have up-to-date technology platforms that easily integrate with an employer's HR system and lets them easily monitor and analyze their HRA program's effectiveness. Finally, employers need a benefits partner that supplies excellent service, including tools that make it easy for employees to track and process claims and that facilitate enrollment and education. We always talk about that participant experience, Eddie, right? So that's the most important thing.
Yeah, education is essential with HRAs, especially if you're offering it for the first time to a new population of employees or to a new client. So definitely lean on your HRA partner there. Very important to explain what an HRA is, how it works, what's eligible, how to access your funds, all of those. Because if you are offering this benefit and your utilization is extremely low, unless that was your intention and you've limited it to very specific expenses, it is a benefit. If employees aren't utilizing it, it might be because they don't understand it. And again, it also goes back to usually simple is better when it comes to plan design. But the nice thing about the HRA is you can always tweak it year after year. So if it's working for you and employees are understanding it and appreciating it, but you need to make a little adjustments to make sure it fits in your long-term financial goals and your budget, you're able to do that each year upon renewal. You can't really adjust an HRA plan design mid-year. Technically, you could enhance the benefit, but you certainly couldn't take away from it. So usually that type of discussion is considered upon renewal.
Great. Is this our last poll question?
I think this is our last poll question. So let's go ahead. And this question is, what would your clients most value in a benefits partner for HRAs? You can answer this as A, the technology platform, B, the ability to communicate HRA benefits, C, the range of HRA offerings, or D, the responsive customer service.
Gosh, those are all so important. I'm not sure how to choose. Everybody should have a responsive customer service, obviously, but it doesn't always happen.
All right, looks like we have almost all our responses in, so let's check out these results. And number two, well, that fits. We were just talking about, customer service, but also education. So 35% of you responded responsive customer service. About 30% said ability to communicate the HRA benefits. Again, very important. 19% said the technology platform, and 16% said the range of HRA offerings. So thank you again for your participation here.
Thanks, Eddie. So that's the overview of HRAs and how they can be customized to meet employers' needs and give them greater control in their healthcare expenses. We've got some time for questions, and I think we've already got a few in the chat. I'm going to let Eddie take a look at those while they're coming in. And while he does that, just remind you that we will be sending you your CE certificate and a copy of this presentation so that you can review it and share with your colleagues. And we also appreciate you being here.
So a couple questions really quick before we wrap up. One of them was, can you elaborate on the waiting period class for ICHRA? Yes. That would be something like, let's say, your employee new hires are not eligible for benefits for 90 days, but you want to offer some sort of benefit or some sort of relief while they're in that waiting period. You could offer an ICHRA to those employees who are not yet eligible for the group medical plan, but have been hired, and you can provide them with some funding to be able to go purchase an individual plan, so at least they have some coverage. Maybe it's cheaper than being on COBRA from a prior employer, but at least they have some coverage before they are fully eligible to join the group plan. A couple of other questions. Let's see, employees can share in HRAs. That was referring to cost sharing. So if you have a deductible that's $5,000, the HRA could cover, say, 75% per claim, or the first 75% of the deductible, or the last 50% of the deductible. That's really what was meant by employees sharing in the HRA. It's just sharing the cost, kind of like co-insurance, but sharing it between employee and employer. Let's see what else. Have the rules changed since the lift of the COVID emergency? Not really for HRAs, no. HRAs were less impacted by by COVID changes compared to like FSAs and the commuter benefits, so not really many changes there. What's new this year in HRA, HSA, FSA besides limits? Really not much changes, regulatory changes. There were several hundred items added to IRS 213D list of eligible expenses. So there are quite a few more over-the-counter items that you can purchase at the pharmacy under 213D. But outside of that, not too many changes. There are a couple pieces of legislation that they're looking to put through regarding HSAs and expanding the access to them so that folks who are not necessarily enrolled in a high deductible health plan could take advantage of them, or someone who's on Medicare could still contribute to an HSA. None of that has been pushed through, but those are things that I know some folks are looking to have approved. And this is a great question. If you participate in an ICHRA, are you still eligible for subsidies in the exchange marketplace? Typically, no. The answer is no there. They do eliminate or offset your eligibility for tax credits. So that is something that we help employers with and is important to understand. We can provide you with additional resources on that, but something an employer has to weigh. Do I want employees spending my money instead of the government's money if, they're eligible for that tax credit anyways? So we could dive deeper into that, but your local sales rep will be following up with you for any questions that we were unable to answer because we are at 1 o'clock Eastern right now. So with that said, thank you so much for attending today. Becky, great job as always. Thank you. And, we'll have your CE out to you in the next couple of days.
Perfect. Thanks, Eddie, so much. And thanks, everybody. We'll see you soon.